Hi everyone, my name is Mirshad Mukhtaran and I'm a PhD candidate in Biomedical Informatics Laboratory, University of Pavia, Italy. I'm going to present a study performed as a teamwork in our lab with the title Obstructive Sleep Apnea Home Monitoring using a commercial wearable device. I will present the study under these titles: Introduction, OSA, including OSA, polysomnography, and objective, and then methods, including patients, wearable device, and data collection and visualization, and then results, discussion, and finally, conclusion. OSA means obstructive sleep apnea. It's a common sleep disorder which can be presented by momentary and cyclical interruption in breathing rate. It's usually caused by extrathoracic upper airway obstruction or a brainstem respiratory motor reduction, or maybe a combination of both of these causes. It means a combination of central and obstructive events. Then about polysomnography, which is an evaluation method for sleep, and it's a gold standard evaluation of SOA, and it is usually used for both diagnosis and also assessment of treatment effectiveness, and it's provide stages including wakefulness, N1, N2. N2 means light sleep, and also N3 means deeper sleep, and REM stage of sleep. About the objective of our study, according to PSG, which requires many sensors connected to the patient body, and also we need the operator trained for doing the PSG, and also a patient must come to hospital and stay over the night. So if we can find an alternative method which can be performed in non-laboratory setting, can be useful. And the Fitbit as a smart band can be candidate to use for sleep staging, and we were thinking maybe it can help the physician to evaluate the patient situation, so it can facilitate the evaluation of the OSA patient instead of use of PSG in treatment efficiency. As a part of method of the study, our patients include 26 patients, all of them clinically diagnosed with OSA, including all of the patients have more than 18 years old, and all of them signed informed consent. And we excluded a patient who have other sleep disorder or who had severe systematic problems. The study and collecting the data started this September 2020 and finished on April 2021. Fitbit Smart Band charge 3 was the wearable device we were trying to have the experiment with it, and it can provide us sleep stages including wake, light, REM, and deep sleep. In our data collection, we try to use PSG and Fitbit in same time for each patient. 3 full night sleep measurement were done. The first night, or T0, was the basal registration. It means before undergoing treatment. T1 or titration phase, which is after the adoption period to therapy, and the last one, T2, which is at the end of treatment period. And PSG data needed to be transformed in a file for every minute to determine the stage of the sleep for all of the patients for all of the 3 nights. Also, a software was developed to represent the result of PSG and Fitbit in same diagram, or also separately, to help the sleep medicine expert to evaluate the result and comparing them. We perform 2 phase for results, qualitative results and quantitative results. In qualitative results, a sleep medicine expert reviewed the diagrams to check if the feature and pattern detected by PSG is detectable also with Fitbit. In general, qualitative results show that 2 hypograms become more similar when sleep become more regular. It means after the treatment, when the patient sleep started to be more regular, Fitbit can show the stages more accurate and can show the sleep is regular. And in quantitative analysis, we try to calculate some sleep indices, including total sleep time, sleep onset latency, wake after sleep onset, percentage of the time spent in different stages, and sleep efficiency. This table represents the correlation between sleep indicators provided by Fitbit and PSG. PSG as a standard and Fitbit as a or test or experiment. And it represents a kind of good relationship between Fitbit result and PSG, except for SOL and WASO. And we can see after the improvement of the treatment, we can see some improvement in correlation for the indicators SOL and WASO. Also, we calculated sensitivity, specificity, overall accuracy, and accuracy for light, deep, and REM stages. Also, with shown PSG as the standard and Fitbit as the test. and we can see again some improvement after the treatment in the Fitbit result, especially in REM phase. As a discussion, we now we can say Fitbit it's not enough accurate for OSA diagnosis, and we should remember the guarantee of 1 minute steps are staging resulted by Fitbit. We know it's not enough sensitive to detect the short-term events and in sleep. However, after the treatment, we can see Fitbit can detect significant macro changes, especially after the treatment and when the patient improve to have their regular sleep. And finally, as a conclusion, in other words, we can say Fitbit can provide us stages in 3 phases of evaluation, but it can show an acceptable improvement after the treatment to show and to represent the improvement of the treatment and to show that patient have a regular sleep or not. And at the end, I would like to thank you for your time and attention. Thank you so much. Bye.